good to be back. I have the gorgeous Veerle here with us tonight to talk about a topic that you're all going to go, sorry, what was that? But it's hugely, hugely important. And I am absolutely convinced everybody is going to get something out of tonight, because it is a topic that we don't talk about, but it is going to affect every dog, because it's affected by age as well as disease, and we all want our dogs to grow old. So this is a really, really important topic tonight. Before I let Veerle introduce herself, as per usual, please understand the huge amount of work that Cam does in and around this area. We obviously have our lives, we have our website, we have our Facebook page, our Facebook groups, we have a forum, we have a shop, we do practice trainings, we do consultancy, we do loads. But we also have this beautiful, beautiful book, which I'm very, very proud of, because it will immortalize my dog forever, the adorable Holly, who's no longer with me. But this is an illustrated children's book to try and prevent dog bites. And in my career, I've put many dogs to sleep that didn't need to be put to sleep, because they were put in the position that they bit a child or a family member because they were in pain. And I really, really feel that it's our duty to try and talk a bit more openly about this situation and try and prevent it. So this book is very much about raising awareness in the family of how dogs are allowed to behave when they're in pain, so that we can work around them as much as possible and avoid these situations. This is a major fundraiser for CAM. We are an independent organisation. We look after ourselves, so we can make sure that we give you guys independent advice. This is a pillar of finance for us, so please do get behind it. Right, back to you, my lovely. Right, tell us about yourself so everybody can be really like, oh, she's
Right. My name is Veerle. I'm a vet. I graduated in Belgium and came to the UK in 2003. And I worked in normal routine practice, mainstream practice for a good 5-6 years, and then got special interest in acupuncture. And I always, because of where I'm from, I always had an interest in herbal medicine. And in this country, when I came, there wasn't that much around. So I started training in herbal medicine. Via acupuncture, I discovered chiropractic. So I have a chiropractic qualification and started working in rehab. So for the last 12 years, I've worked in referral only. So that means I'm working in a rehab practice, or I see clients for complementary medicine. So not alternative medicine, just medicine that sits along the conventional, that complements. So I use herbs, supplements, nutrition, physiotherapy exercises, acupuncture, manipulations, chiropractic adjustments, but I would say mobilizations. And yeah, that's my main line of work. And I have a special interest in pain and osteoarthritis because of the kind of cases I've seen over the years. So yeah, that's now 12 years. Yeah.
We were just talking earlier about imposter syndrome, because the nature of what you do, especially vets, female vets suffer terribly from imposter. But I'm just going to tell you now, listening to you talk, I'm like, I so want to be her. You've got all the skill bases that I want, which is awesome. It's really awesome.
But I went to a conference once, and one of the leading herbalists in the world was there, a vet, and I was presenting something alongside her, and I said, when I was little, I wanted to be her, and it was the most massive thing. I stood next to the person I had always looked up to, and I thought, actually, I got there, and it's sort of we all get there if you sort of keep going.
Keep trying. Yeah, exactly. Okay, so enough of the mutual love going on here. Let's talk about sarcopenia. So please explain what sarcopenia is so people know what tonight will be about.
So sarcopenia is the muscle loss when there's no underlying disease. So cachexia is when you have loss of muscle and fat due to disease. But sarcopenia is a loss of muscle. Often that's due to age. We all age. So in humans, we start losing muscles from the age of 30 years old. And between 20 and 80 years old, we lose 30% of our muscle mass. So that happens in dogs as well. So we'll see dogs lose muscle due to age, the hormones, they're less good at metabolizing the protein. They just have underlying health issue, mobility issues, which means that they're not using the muscles, low grade inflammation. So it's a very natural process. And if you look at the human literature, there's loads of available, because I've never met a 95-year-old lady with huge bulk muscles. And I've never met a 16-year-old dog with really big gluteals and hamstrings. If they have hamstrings, we have to work extremely hard to maintain them. So there's actually more and more people getting interested in the muscles and how we can maintain that healthy muscle mass to support the whole body, because, you know, there's joints and ligaments and tendons, but the muscles are sort of kind of keeping it all together. And we really need to consider sarcopenia as one of the kind of things we need to beat in aging dogs, or at least acknowledge in aging dogs.
Yes, absolutely. And I think you hit a real nerve with me in that my journey into this started 2011, when I just realized one of the biggest volume of the body is soft tissue muscle mass. And I knew so little about it as a veterinarian, in that we're quite good at joints, so we're pretty good at bones. We're not bad at the nervous system, but when it comes to muscle mass and, you know, muscle function and keeping them healthy, when we're not strong in that area, if I'm really honest. So yes, I totally agree with you about that. But what is the repercussions of sarcopenia? What does it lead to? Why is it important that we're talking about it?
So if you think about the framework of the skeleton, everything is connected with ligaments and tendons. Muscles are attached to tendons, to joints. If you get muscle loss and strength loss, for example, even in the spine, the underlying structures will have to work a lot harder to keep that stability. You also get timing issues, for example, in your hind legs, your gluteals, your hamstrings, your quads. They all need to work together to get that knee to work properly. Now, if some of this kind of the input of the nervous system, the timing of the muscles goes off, or they fatigue a lot faster because you take them for a long walk and they haven't got the strength anymore, or the kind of tone anymore, you can actually put an extra strain on those underlying joints, and then you end up with injuries, and then, you know, off you go down a slippery slope. So it's not uncommon in rehab that you have a client that comes in, oh, I've come for the cruciate, you know, had a cruciate surgery and I'm coming for rehab. And then you ask, and the other side was done the year before. But actually, I'm saying, we need to rehab the other side because the muscles on that side are not ready to take the load of this surgery. And that's the kind of thing that we have to think about. The skeleton as much more than the skeleton. It's all the tissue around it is so important. The myofascia that lies around the muscles. But, you know, the mass is sort of the tone, and the timing of the central nervous system into those muscles is so important to create stability in the body.
Yeah, really, really important. And I think that, just a little tangent, you hit another great key point for people to take away. We often get approached with people showing concerns about exercising young dogs, and the focus is always about bones and joints, bones and joints, bones and joints. And there's a real tendency to kind of go, I'm not going to do very much exercise. I'm not going to let them do very much. You're sitting there going, no, because everything needs to develop. And again, soft tissue takes a back seat in people's, you know, forefront of their mind of, oh yeah, they'll cope. But actually they need to develop so that we have fluid, stable movement, don't we? So,
and I mean, we don't restrict our children, you know, as long as you give rest periods. And there's in human exercise, you know, sport medicine, there's overtraining syndrome. Yeah. And there's, you know, all kinds of syndromes where muscles actually get damaged by wrong training or overtraining. So you can overdo it, but it's all about having the kind of rest periods, recovery periods, the good nutrition, you know, training in a way. Even your puppy, you can do some basic training so that you get the timing of these muscles. It's not uncommon that we see young dogs, and I'm like, well, they're a bit tight on the right in the quads. What's going on here? So is it that they've uneven started to develop and stuff like that? And it's important because at that moment in time, there's nothing wrong with those joints. These are healthy puppies. But I find the soft tissue already reactive. So something is not adding up. The movement isn't fluid. And then over time, you will, form dictates function. If you're walking skewish, and it's all linked. That's the important bit with the young dogs. So having an assessment done on an 8-month-old puppy by a physiotherapist or by a massage person or somebody who knows about musculoskeletal health is an investment. I like seeing my puppies at 8 months because I will pick up, this dog has no abs, this dog has no glutes, but has really strong hamstrings. Let's work on the glutes, and sort of that way think about joints in a more kind of holistic way.
I think a kind of little kick to the mind to many people is they like to see their dogs being athletes, and they like to see them being able to do these amazing feats, jumping from floor to 4 foot up, just like that. They are athletes, and I think we need to take more attention to their physical being. And then you're right, it's an investment, having those routine checkups. So if anybody's going, oh, this hits a nerve for me, you can always see a physiotherapist or a rehab person on maybe an annual basis and ask to have a physical assessment. And wow, what an incredible investment throughout life that would be. That would be really awesome. But anyway, let's get back to it. So why are we talking about sarcopenia with regards to arthritis? Because this is CAM, Canine Arthritis Management. Why did, when you say, let's do that, I went, yeah, this is so important.
So, for example, if you think about the dog with arthritis in the hips, so what we want to do is create a really good gluteal muscle mass. So we need to find strategies. You treat the joints and you think about arthritis regarding the joints, but you need to take the muscle mass that surrounds those joints as a kind of part of the joints. Does that make sense? So you actually support the joint with those muscles. So that's why with arthritis, again, if your timing between your quads, your hamstrings is off because they're just weak, loss of tone, loss of muscle mass, there's going to be much more torque, instability on those knees. And that's when you'll all of a sudden they take a wrong turn. I call it the footballer's knee. They go right and the muscles are not timing. They're not ticking like that. And that's it. You get a massive flare up of your arthritis. And we've all seen them come in. Oh, they've always arthritis. They did something wrong. And now they're on 3 legs or they're in real pain. Often it's the joint that has just been irritated because of the muscles around it not timing properly, not working properly, being over-exercised. And that can be even on a normal walk, just recruiting the wrong muscles at the wrong time. So
So I'm going to just take the opportunity to just kind of do a little bit of the pathophysiology of OA. So a lot of people kind of just imagine in their head, the deposition of bones. So you have that Lord of the Rings kind of gnarly joints. But what kind of precedes this, guys, is in dogs, the most common reason we have arthritis is due to developmental joint disease. So it's patelloluxation, hip dysplasia, elbow dysplasia, osteochondrosis. And what these diseases do is they create an environment which is unstable. So you have abnormal movements that can allow degenerative processes to take place. And then you have this negative cascade going on with inflammatory mediators, thickening of the joint capsule, disappearance of cartilage, subchondral bone, the bone underneath the cartilage that takes the impact forces, starts to become thickened. Now, all the nerve receptors that generate pain, which is what you're concerned about, your dog is in pain, that's what you're trying to prevent. That's not actually within the cartilage, that's within the bone, that's within the joint capsule, maybe within the cruciate ligament, in the surrounding soft tissues. And they are ready to fire. They're on high alert. They want to fire pain signals to that brain. So if you could keep the joint stable, and if you can have appropriate movement, then you're not likely to fire them off so much. This is really simplistic. But if you've got a joint that hasn't got stability and it's allowing abnormal movement and it's putting torque on the joint capsule, it's sliding across the cartilage, it's compressing the subchondral bone, you are basically creating more signals of pain going up to the brain. So stabilizing those joints, having stable, predictable, fluid, comfortable, well-cushioned movement will reduce pain, and it will potentially slow the degenerative process. So stability is what we want, and this is exactly what Veerle is talking about. That soft tissue, that dynamic stability created by muscles is key, and it will influence your pain management plan. Hopefully that makes a little bit more kind of sense why this is so important. Right, so let's crack on. Now, situations in which sarcopenia arises, and when you talk about sarcopenia, you're talking, does it happen just locally? Is it happening generally? How do we identify it? How can people kind of realize that their dog might be suffering?
So you can literally have it after periods of inactivity. So they don't need to be poorly. You're just having a reduced activity due to changes in their kind of joint mobility. So they're slowing down. That's what we hear often. They're slowing down. So you can also hormones. Hormones are really important. And with age, our hormone levels change. So hormones will have an influence. The way we feed ourselves, so we get better at putting on fat and less good at putting on muscles. And, you know, everybody of a certain age knows that happens. So you metabolize food different. Your efficiency at building muscles goes down with age. So age related is in there. So inactivity, hormone status, age. And then steroid use, for example, some drugs will affect muscle mass. So I call them steroid bunnies. These are the dogs that come in, whoa, I feel great, but I haven't got a bum anymore.
Yes.
And then literally they walk in and you see their bum ends is sort of still in the car park when they're inside. They have a hang belly. And those are, you have to work them so hard to keep that muscle mass. And for some conditions, we need these steroids on board. If they have autoimmune diseases, we have their life-saving drugs, but the side effect is that they can really lead to muscle loss. So that's where you're sort of fighting with the tap open, you know. And that's I find those really difficult, because the first thing you need to say, your dog is really going to have to work super hard to maintain this muscle mass. And, you know, if you don't work, the steroids will make that we have.
They drop off quick as well.
Yes. Yeah. And even if you stop the steroids, if you look at the human research, I saw an article where it actually, even when you stop the steroids, it doesn't necessarily go back to normal. Does that make sense? It's sort of permanent kind of changes can happen. So that would be, in short, the main ones that I see as sources of sarcopenia.
And it's just a tangent there. I think a common situation we see steroid use is allergies, ear disease. So that, and as you say, autoimmune. And I was just thinking, it's the weirdest conversation to have with an owner when they've come in with an ear disease and they've got maybe a really narrow ear canal, and we're like, got an infection, narrowed ear canal, we need to really get an anti-inflammatory to hit this hard, otherwise we're going to have a serious painful problem here. And then you go, and by the way, steroids, you know, is going to lose muscle mass, and they're like, we were talking about the ear. And we're talking about his bum. What are you on? So it is very difficult for owners, but hopefully spreading the message like this will help people understand, you know, these medications do good, but we also have to be aware of what else they can do. So how are people going to identify sarcopenia? What's the sort of things that they will see?
So as an owner, the first thing you'll see is the shape of your dog changes, where you have actually the pin bones on the back. You might start feeling them. When you run your hands over the top, you might feel that there's a lot more bumps Take pictures. I like profile shots, and you take a profile shot when they're 2 years old and a profile shot when they're 5-6 years old, and you start seeing them, their postural control. So they'll actually, you stop by the traffic lights and they go and sit down. That might be osteoarthritis, or actually the muscle saying, I need to sit down. So, or you stop in the street to talk to somebody, and all of a sudden your dog says, I'll just have a sit down while you have a chat. And that might be pain, definitely, but those could be markers. Again, if you have a routine relationship with a musculoskeletal person, which can be massage, there's so many different kind of style of people that do musculoskeletal work, but one of the things they do is assess muscle tone and mass. So in veterinary medicine, we do body scoring, but we really should be muscle mass scoring as well. So we look at kind of where the muscles sit and how they feel. And I have clients that come in and it's like, I had this dog, he's called Frank, and he's got the most beautiful pecs in the world. And I actually said to the owner, your dog has the most stunning pectoral muscles. And nobody had said that to him then before. But of course, if they start slinking, we will start, I have a relationship with those pecs now, meaning I will notice it.
Nowhere else could you have this kind of conversation.
Exactly. And it's sort of getting somebody else to also assess the muscle mass, I think, is very important. Weight you can't necessarily use. You could, we can measure, with a tape measure. You can sort of say left and right. That's the kind of the muscle bulk that we have. But again, I think leave that to a professional. Once a year, a checkup, you should pick these things up. And
also talk about how everybody has owners come in and they believe that their dog's very well muscled, but it's inappropriately muscled. That's something else I see a lot. Yeah. So we're going to just leave sarcopenia for a moment and just talk about our experiences as veterinarians when people come in and say that the dog's a hench, and you're like, at the front end, but not at the back. Hey, what's happening back here? Or you might find a dog is just hench all the way down its back and it's guarding and it's really protecting its spine. And you go to feel those muscles, you're like, they're not a happy firm, they're a solid angry. And so I'm still very much learning, and it comes with a lot of experience and a lot of palpation and a lot of work in this field. And I've got a lot to learn, but it is something that comes with experience, isn't it? Palpating, going, that's happy, that's not happy, that's balanced, that's not balanced, isn't it? Can you explain further?
Yeah, so I call it the triangular dogs, the tripods. They literally have a little bum and a massive front end, and the muscles, I think, even as an owner, you can feel it. It should feel soft. And we talk about crunchy. We talk about taut trigger points, where you have these points where your dog is supposed to like, oh, get off me, that hurts. It's the kind of, it should be soft and not flinchy when you touch, even when you sort of put your hand on their back end and they go like, you see a ripple go down their back. That means a super high tone. Or even putting them on 3 legs, and you have to sort of, you lift their legs to clean their feet after a walk, and you literally have to hoik the leg up because they're like, they put all their effort in staying standing, Yeah. And it's sort of, if your dog hates massage, that's fine. But if it's new that they hate touch and they hate not liking be touched, or edgy around the kids when they come for a cuddle, that can be actually that the muscles are like, I'm actually really not happy. And that doesn't necessarily need to mean that you have a super angry joint underneath, but it gives you a warning signal. Things are not well.
Yeah. No, absolutely. And I think some things that I show owners, just to try and get the point across, is things like scapular glides, which is the shoulder blade is not attached to the body by bone, guys. It's attached by soft tissue, and there should be movement because that helps them land and take, the pectoral swing, the shoulder girdle. And then when you front the owner and you're just like, that's an indication that we're actually building up huge amounts of compensatory muscular tone, for example. So what I'm trying to say in this is that we're concentrating on muscle mass loss tonight, but please guys also look at the other end of the spectrum, and we do see a lot of situations where owners go, no, it's got great muscle tone, and it's either unbalanced or it is actually because there's an underlying problem going on. Right, so stop tangenting, Hannah. Get back to the point. Why does sarcopenia develop in OA dogs, so osteoarthritic dogs, which is what we're all here about? So obviously we're going to review what we've talked about before and just put it into context. And this is what I've written in my notes. I really want to spell it out to people that this is a cohort that is super prone, and this is a big message of things that we need to do something about. It's the part of the management plan which actually isn't hugely expensive. Let me explain. I was chatting to an owner today. She immediately said, look, I'm a pensioner, Hannah. I can't afford a huge number of interventions. I don't really know what's left to do. And I was like, so much is left to do, because there are so many things that we can be doing with your dog that don't cost a lot of money. So listen in if you want to know what it is. So tell us about OA dogs and why sarcopenia develops.
Because of inactivity. So if we are not exercising, and on the note of exercise, exactly, it's that little bit every day, several times a day, your little physiotherapy protocol. I have got clients who have got a tick sheet, 5 sit stands, backwards walking, sideways walking. So recruiting the little muscles. So in your spine, you have all the multifidus, the little muscles, they need to fire. And by creating a little bit of an exercise regime, if you walk out, go up and down the curb, so you get flex and extension. Backwards walking, I love backwards walking because again, it recruits other muscles. And sort of sit stands when they lie down. When you talked about scapular glides, I always like the tortoise reach with their neck, so that they actually come for the first time out of their neck, that they sort of become a little bit longer. But I put them in Sphinx on the floor so that they're supported by their belly, so that they don't hollow their back. So that's where you then support with muscles. You get all these little muscles to get, like, putting information into the central nervous system as well. Proprioceptive work. For the kind of inflammation affects sarcopenia as well. So there, with your osteoarthritis dogs, you will have already kind of things going on there with prostaglandins and interleukins, which are kind of some of the inflammatory mediators. So they seem to affect sarcopenia as well. So again, your osteoarthritis dogs will be very prone to sarcopenia. And that's another thing where if you control inflammation, there's an easy gain. You've got to control the loss of muscle as well. Does that make sense? Sort of, you look at the literature, it comes with antioxidants, the omega-3s that will affect, that we use in joint support, would actually seem to also have an effect on muscle mass. So it is very much interlinked in that whole complex of inflammation.
Yeah. Have you seen someone's just said hello? So this is cool. And also the one that we keep saying is age. Unfortunately, many of our dogs are not being detected as being arthritic until they're older. Big facts for you guys. The leading cause, as said, is developmental joint disease, which we tend to see the first signs of when they're developing developmental disease. But then they get through life. A lot of these dogs get through life, and it really rears its ugly head as they become more senior. But it doesn't mean that they've not been dealing with low-grade arthritic change throughout their life, but it gets to breaking point. And the figures are that around about 50% of dogs are not actually diagnosed until they're over 8. But a big percentage of that 50% have been managing it through life. So do bear that in mind. It is a young dog disease in dogs. So one of the other things to consider is age, which Veerle's just been mentioning. It's a huge underlying factor in sarcopenia. So I think we can definitely take home that a lot of our dogs that we're caring for are going to be suffering from this. Okay, so let's go for prevention. You know, we can separate prevention from treatment, or should we go treatment first?
Well, it's the same in a way. I mean, treatment. So you get exercise, nutrition. From my point of view, I mean, treat all underlying conditions, literally everything. The dog, I need to be the best oiled machine in town. If you want those muscles to work, you need to make sure you don't have other stuff going on. So skin disease, gut disease, liver disease. You need to treat these muscles as a sportman. You know, they're going to have to work hard to support your joints and, you know, live in good old age with a decent amount of muscle mass. So I would say at the age of 6, 8, you need to start thinking, you know, these muscles are going to go. I need to keep them working. So prevention and treatment, it is the same, because if you, once it's gone, it's very difficult to get it back.
Yes.
So
let's start with prevention. Let's take a fictitious case. Let's take Luna. Luna's now 3. And I wake up on her 6th birthday and go, shit. I want to be super proactive. She's got no underlying disease. So let's take a healthy individual. So her skin's good, her gut's good, she has normal stools, she has good body weight. Let's take that as the most simplistic case of I want to be prepared for the future. What sort of things would I be thinking about doing?
Appropriate exercise. So that would be my main thing. So think about muscles, not exercise as a kind of the way we think about exercise for ourselves. We go to the gym, we work our quads, hamstrings, you know, we think about exercise, but with dogs, we don't necessarily think that way. So we'll take them for a walk, but actually think, what are we trying to achieve? And it doesn't need to be very formal, but you do need to make a whole kind of exercise regime. So, work on the quads and hamstrings and glutes, backwards walking, as I said, sit stands, sideways walking. I think a lot of it, I say to people, think about some basic agility or core strength exercises, wobble board, wobble cushions. And again, if you get some advice with that, that will help, because your dog and my dog are not the same. Your dog might say, she hasn't got any abs. Let's work on the abdominal muscle tone, or let's work on the glutes. Or I might have a dog that is quite rigid in the neck, so we'll do a lot of neck stretches and neck, making sure those muscles relax and don't become hypertonic and completely stuck that way. So and make sure that all the muscles work. You know, do variation in your exercise, and you know, don't do kind of full pelt throwing bowls and frisbees. You know, because that's a kind of very fast acceleration, kind of impact exercise, not just on the joints, but also on the muscles. So actually think about exercises you do. What do you want to achieve? And it has to become innate. It has to become second nature, if that makes sense.
Yeah. I must admit, so I used to be a lot better than I was. I've been a bit caught up with work, and I do my emails whilst walking the dog. But what if you are a bit like me, where your life's quite busy? The things that I'm doing at the moment is I make sure I have a very mixed terrain. So I'm always walking in different textures. There's steps, there's up, down, we're stepping over things, we walk on cobbles, we walk on beach, we walk over rocks, we're doing uphill, we're doing downhill, we're in the forest, and I make sure it's very, very varied. And then on my walks, I will do things like Veerle was saying, we do sits and downs, we do scent work. I've always got stuff that I'm doing, but I'm not a prescriptive in my living room doing 10 of this, 10 of that. I wish I could. I feel guilty. I really do feel guilty, because Luna is the love of my life, but my life just isn't like that. But I do, on my walks, try and add that variety into it. Can you just have a little tangent talking about postural muscles versus like dynamic power muscles, so we can just deal with the ball throwing, and the fact that just because your dog can hit speeds that are sublime and come back to you doesn't necessarily mean that they're physically balanced. Just tell them the difference between.
Yeah. So when they go off and get the ball, they recruit kind of different muscles than the ones that you do when you stand. So standing is actually also, or even just keeping a sitting, like a square sit, and just sitting, you can actually see these puppies. They come in, and sometimes, and you see their bum is sort of they go off, and it's that kind of little kind of muscles that help the posture control. So think about Pilates in humans. It's all about finding that posture. And core is not just, it's not just having a belly, a six pack.
Not the bikini body.
It's about all those little muscles in the spine as well that stabilize the spine. And you will not fire those correctly if you just throw ball stuff all the time. I've got clients, I often do it with the young dogs. I put them in Superman, so if right hind, left front, and I see if the dog can actually hold their posture. And I said, I need to be able to put my cup of tea on their back, and it should stay there when I lift one front and one hind leg up, opposite sides. And when they can do that, then I'm like, they get top marks, because that's hard, and that pelvis needs to just hold. And I get clients to do it themselves. So they go on all fours, lift front leg, their right front arm and their left hind leg, and go into Superman. And it's like, whoa, I can actually feel, or even just go into a squat and just hold for a few seconds. They're completely different muscles. I don't know, if you do 20 squats the next day, I'm much sorer than if I gone for a 20-minute run. So that's the difference, actually. Do those exercises, completely different muscles. But that's the thing, that the muscles that keep your dog standing at the red traffic lights, if that makes sense, they keep that body supported and healthy, rather than all those fast moving muscles, fast twitch move, that is, they need that explosive power, but they can be really strong in that and be absolutely shockingly bad in their core. The amount of agility dogs do the Superman, and they're like, whoa.
Yeah. And I think, is it fair to say that I'm just dredging in the back of my brain, the postural muscles are more likely to suffer from sarcopenia quicker than the dynamic power muscles? So be aware of that, guys. And I've just got another tangent I've got to do again. You were talking about standing at traffic lights and them choosing to slump, choosing to sit. And yes, it could be pain, but it could also be muscle fatigue and paresis and weakness. And it really reminded me of when Dr. Nick Jeffrey was, Hannah, we need to talk about peripheral neuropathies. I'm having a huge number of dogs brought to me that are having more and more and more pain medications, and we're getting the side effects of polypharmacy when they're not in pain. And I just kind of was thinking to myself, that is another classic example where an owner goes to the vet and says he's still painful, and the vet goes, here's some more. And actually the dog's not painful, they're just weak and unable. And that's a very big difference, guys. This is another big reason why I truly believe having the input of a physio into your OA management plan is worth the weight in gold, where you can pick up on stuff like this.
And I personally think that neurodegeneration, if you look at some of the literature, is present as well as sarcopenia in a lot of patients, because we look at the pathologies and we say pathologies, the diseases, and we think, degenerative myelopathy, canine cognitive disorder, that's the black side, and the white side is normal. But you have, between that black and white, you have a whole grayscale. And I know my neurotiming now is, meaning the fast movement is not what it used to be. So I hear less, my sight is less, my smell is less, but I'm not even old. So why can't we in dogs have a very slow degeneration of the central nervous system, but we can't measure it because they can't hear anymore. So they can't hear anymore. They can't smell as well. They can't see as well. So let's think that maybe all those other nerves are not firing as well either. They don't give the information to the muscles. The muscles lose tone because the information, if you put garbage in, garbage will come out. And I think there's a whole gray scale. So I would say neurodegeneration and sarcopenia in old age is very difficult to measure, but maybe we should assume that it's going on.
Yes.
And it will affect your OA patients so much. And we are, in human medicine and in veterinary medicine, slightly limited in our options treatment-wise. You haven't got a pill for that. You haven't. It's literally what I say. If you put garbage in, garbage will come out. So if you do not put exercise in, nothing will come out of this body.
Well, let's talk about treatment now. So we've talked a bit about prevention, and supplementation will come into treatment. So let's jump, because supplementation could feature in prevention as well. But I think my biggest take homes for prevention is awareness. Be aware that this exists, and yes, have a few plans in place of keeping your dog appropriately active, keep their weight under control, maybe having a yearly assessment with somebody that's really used to handling soft tissue. Consider supplementation, but we're going to come to that in a minute. Attend to any disease promptly. Think about the medications that your dog is currently on. We're not saying don't give them, for God's sake. No, 100% not saying that. But be aware with anything that works, it could have a side effect. And this is a horrible truth. You know, I've had so many specialists say to me, if something comes with a promise that it's got no side effects, it's probably not going to work, because anything that has the power to work could have an adverse event. So learn what they are. So if your dog's on, say, steroids, understand, yes, it's probably life-saving, but there are things that you might want to attend to behind the scenes because of adverse events. Let's now go on to treatment.
Yeah.
Okay, so I'm just going to let you go wild here, because this is where you're going to flow.
So I went down a rabbit hole in the last few days reading up on all the human side of things. So we look, definitely nutrition is a massive thing. We should look at good quality protein and good quality essential fatty acids. So there's definitely evidence that omega-3 fatty acids will help with maintaining muscle mass. And it's good for so many other things. It's good for the central nervous system. It's good for the skin, it's good for the joints. So we can actually safely say that if you look at nutrition, you need to look that there's enough omega-3s present there, that you have a good, adequate protein uptake. So I always, to my patients, and that's, again, it's very individual, and I wouldn't want anybody to sort of go home and freestyle with food. But when you get older, you do not, what happens on the outside, the wrinkles and the gray hair, it's also happening on the inside. You become less efficient at food absorption and digestion. So again, if you have an underlying bowel issue, you really need to address that, because you can't combat sarcopenia if you have a poorly digestive system. So I'm often a big fan of fresh food with older patients, so that they actually have a good quality protein and easy digestible. So again, that might be something that, sometimes I add probiotics or prebiotics just to make sure that the gut is in the best possible way to absorb the nutrients it needs. If you look at the humans, then you look at anabolic steroids. We had a chat earlier about anabolic steroids. The side effects of anabolic steroids is not really useful for us, because it's a short-term hit and it doesn't last, and the side effects are potentially quite dangerous for the liver and behavior wise, and it's just poor medicine if we would tackle it that way. So you have what we also know is hormones. For example, entire males will keep their muscle mass a lot better. So in humans, then they look at supplements that affect testosterone levels. Again, we have a huge nutrient population, so that's not really something we can easily use. Again, the anabolic steroids link in with that. I personally use a lot of supplements, herbal supplements that I add. If you look at the literature, there's also L-carnitine, which is an amino acid that is present in beef, in red meat. But we find in the literature, you can see that it actually helps maintain healthy muscle mass in human athletes. It's interesting that the Russian skater,
Oh yes, what was it?
she had taken L-carnitine. So
Actually,
it's not, that wasn't one of the things that she was banned for, but it was found in her blood sample. So a lot of athletes seek L-carnitine. Side effects, you can end up with gastrointestinal upsets. But if you look at some of the good quality foods, a lot of them will have L-carnitine already added
well, that's
in.
what I was going to say. I think for me, and this is just me, so no one shoot me down. I am, even though I've been a vet for 20 years, I'm not a nutritionist. And yes, it's on my list to do as I get older. I'm going to tick all of these things off one thing at a time. But for me, making my own diets is just not on my agenda, and it's not within my capability, a consistent, methodical process. So do go for the best quality of what you can afford, and it doesn't you don't have to be on one side of that fence or another. Cam prides itself in being completely neutral between raw, home cooked, commercial based. We do not point fingers and we do not make people feel uncomfortable. I myself am commercial food, and that's what I can do, but I choose a very good quality that's suitable for my dog's age category. And I focus very heavily on keeping her body weight correct. I check her stools, I check her energy levels. So just, don't beat yourselves up. I've had, right at the beginning, I had a few emails from people that were sad, really upset, because other people's ability to put things into their management plans made them feel inadequate as an owner, and that's not allowed. You do the best for your dog. Is that fair to say?
Yeah, and I've got a very elderly cat, and I tell you, I can buy her the best quality food. she doesn't want it. She wants what she's grown up with, because they're used to it. And with age, some of these dogs get cognitive stuff going on as well. And I get clients, and they come in and they have thrown out all what they used to do 2 years ago and have gone completely freestyle with food. And you feel sorry for them, because they try so hard, because they've read online this and that. But actually, it's what suits your dog, but also what suits you socially, what your home setup is. Have you got the space for it? Have you got other dogs? Because if you feed a very high value food, it wouldn't be the first time that there's been a dog fight in the house because of. And it just, I think be kind to yourself and be kind to your dog as well, because you don't want to sort of completely, I mean, it's like putting, 3 steaks in front of your 95-year-old grandmother. They look at it and it's like, well, I'll have a bit of porridge if you don't mind. Just.
How am I going to chew that? Yeah. So nutrition definitely has a role to play. And I think if you're interested in learning more, I think it's worth having a conversation with your vet. There's now many veterinarians and good quality nutritionists out there that can support you further. What I see a lot of people do is they'll jump onto Amazon now and they'll just buy shed loads of L-carnitine from any supplier known to man. And we all know that that's a very dangerous way to spend your money. You quite often are wasting it. So do bear that in mind.
And what L-carnitine, I think it's just so easy. I read a paper and it sort of makes sense. But if you don't do anything else, you're just going wrong here, because you're patching up something, and you can make very expensive poo, and if it's not necessary. So be very careful when you put these things in place. Take advice, make sure it doesn't actually interact. And it's sort of a lot of these things, there's no big trials in animals yet. Some companies run trials on supplements, but often it's a proprietary blend. So it's a bit of that, a bit of that. It's not ever like 2 tablespoons of L-carnitine every day. And that's the thing. I think it's so easy to go home and buy lots of these things. and actually not really understand what you're trying to achieve, what it's supposed to do, and how you're going to measure the outcome. Because I have clients and they've been given L-carnitine for years, and I look at the dog, well, we've got some work to do here. And they've thought for years that they were doing the right thing. And that's important. Make sure that you have a strategy and you measure your outcomes. And that's where you get your professional help. Because if you're going to go and self-medicate without very little strategy, it's not going to work. And you might actually end up doing silly things.
Yeah, and I think we all see this a lot, because people want to do the best for their dogs, so they'll spend a lot of money, and they will buy things with that kind of strategy in mind. But I can assure you guys that the biggest influence is going to be exercise and weight control. Appropriate exercise, targeted exercise, and weight control. You're going to achieve so much more than funding Amazon heavily. But talking about paid for interventions, can we just not give people dose rates, not give people recipes? But when you said that you quite often use herbs, what kind of things come to mind with regards to sarcopenia in a herbal medicine approach?
So one of the herbs that I definitely would use is Withania, which is Indian ginseng, which we know in some mice study, it definitely has shown that it improves muscle mass, skeletal muscle mass. A lot of athletes take it. Withania in huge doses can definitely have side effects on the gut. If you have underlying thyroid functions. So you need to really be very careful with that. And again, Withania is this lovely herb that has loads of different kind of actions, but it has to be part of the strategy, because you can come in and see me and I was like, oh, my dog is for 2 years on Withania. Yeah, but it's got this and that going on. What is Withania? What are you thinking Withania will do? And then sort of I have to often scale it back. Medicinal mushrooms. So there was a kind of gossip online. So about 20 years ago, the Chinese were at the Olympic Games, and the swimmers were winning every race. And there was this story that they were taking cordyceps, which is caterpillar mushroom. So it's a mushroom that grows on the body of caterpillars above a certain height in the Himalaya. Yeah, and it's sort of it's called cordyceps, and I use it in kidney patients, but also in my elderly dogs, so in athletic dogs that do high sport and dogs that have sarcopenia. And it shows that it definitely helps with improvement of muscle strength and tone and performance. Again, these are all my mouse studies or rat studies. And human studies. So there isn't a particular dog study. So we sort of take the kind of science of that and apply it to dogs. Yeah. And the mushrooms, again, you can give mushrooms kilos of it, but it can cause tummy upsets. So again, be mindful of that, because you want the protein to be absorbed as well. So if they have chronic diarrhea, it's also not going to end well. So the other ginseng families, the Panax ginseng, Siberian ginseng, and rhodiolas would be all herbs. So why I use those is sometimes I feel that dogs can't get better because they're having an empty battery pack. It's like there's no kind of not easily available energy. And by giving them ginseng like herbs, I find that they find their battery pack and they've got better quality energy going into the muscles, and then I can maintain their muscle mass much easier. Another thing I use is MCT oil, so not CBD. We're talking MCT, which is medium chain triglycerides, which is a very easily absorbable source of energy for the brain and for the muscles. Interestingly, there was a webinar on one of the vet forums on cardiac nutrition, and they found that it's also easily absorbed by the heart. So again, I have taken MCT oil, and if I take it in a certain dose, I actually get palpitations. So again, it shows you do have to be careful. So a lot of the foods will have now MCT oil. Cardiac foods and neuro foods will have MCT oil added to it. And I don't want anybody to go out there and buy loads of liters of MCT oil and give it to their dog, because you will have diarrhea. And you will have dogs that look at you like, well, I've put my brain in the mains. Does that make sense? So you don't want
the area you really need. Like, I'm listening to Veerle going, I'll phone you. I'll just phone you. It's not something that I'm going to attempt on my own. And, it's okay to ask for help. And, the advice that you get from a consultation is really valuable. I think everybody is just so used to sitting in front of the TV now and popping online and trying to grab what they can. Please don't. Please don't. We were just tempting you with the possibilities rather than giving you any scope to just go and hop online and buy stuff.
And it's the interactions as well. So with Ania and I look at what drug list they're on. And I had this week a funny email from a client who said, well, I've had these herbs, but are they okay with all these drugs? And I said, well, that's the first thing I did, is write down all the drugs you're on. So I know I'm not going to have side effects. I don't need to worry about, causing trouble, because you can cause trouble. And that's the problem with anything online. Plus, also, if you buy online, there's no good manufacturing practice. There's no ethical sourcing guarantee necessarily. So if we talk about the caterpillar mushroom, those mushrooms are quite rare in the wild now. So they're now grown in a lab. So we need to make sure that the sourcing of our product is sustainable and ethical. And the good manufacturing process, because you and I can start a supplement company and sell anything and nobody will stop us, because it's not really, there's not enough protection for the customers there. And I think if you go to a professional, I think all of us will pride ourselves that I will source products that the members of the public can't get even hold of, because I know they're for practitioners and actually of a level of quality that those companies only want to sell to practitioners, because they know that what they're selling is the highest quality product. But that comes with potential side effects. As you said, if it works, there's a risk for side effects.
Yeah, and I think that's really important to know. So I think we've done quite well in that key areas that we can influence sarcopenia is prevention. And prevention can be divided into awareness, it can be weight control, appropriate exercise, targeted exercise, appropriate nutrition, awareness of medication and disease. So that's prevention. Woo! Now, if we're in the zone of treatment, so we've got dogs that have established OA, we've got a lot of changes. They might be post-surgical. A number of people have asked questions about post-surgery. We know that we can potentially influence again by weight control, appropriate exercise, potentially looking down a herbal supplementation pathway, potential supplement pathway in the form of something like L-carnitine, potentially looking pharmaceutically, but we don't tend to play there too much. A lot is unknown. For me, preventing further trauma is a massive thing that I just feel is available to everybody. If you've got weak, paretic, vulnerable soft tissue that you're going, just hang on in there, just please hang on in there. You are my only hope to stabilize that joint. Slipping on floors, on stairs, in and out of the cars, you are just catapulting that dog to an early grave. So prevention of further injury is really, really important there. Seeing a physiotherapist or a professional to give you guidance. A lot of people have talked about asymmetry, they've talked about muscle mass loss post-surgery. It's not advice that we can give you online. We haven't seen your dog, we haven't palpated, we haven't looked at the bigger picture. So I would really, really strongly suggest you speak to your veterinarian and say, who can you recommend to me that is qualified and regulated and experienced in this local vicinity, who will build a good working relationship with you? Because it's not I'm choosing to see them instead of you, I'm choosing to see them with you. So that would be the conversation I'd have. Can you add to that, Veerle?
Yeah, I would say there's also the register of animal musculoskeletal practitioner, the RAMP register. And I'm one of the vets on there, and it was one of the proudest moments. I was like this, hundreds of physiotherapists. And there's little me. I was like, I'm part of that gang. I was so proud of that. But there's quite a lot of qualified people there, and they have, before you could be accepted there, you have to have a particular standard of education and insurance as well. So I think we didn't have the ramp register, but you do have it now. So if you're unsure in your area if there's anybody around, so go on the ramp register and see if there's a practitioner local to you, and if they're not particularly skilled in, there's people there who treat horses. If they're not skilled in small animals, they will have colleagues who they can refer to. And another thing I wanted to say, you talked about prevention, and pain relief is part of that. If you're in pain, your dog is not going to move. And
good call, well done.
And the clients come to me and they say, "Oh, I want a natural route," and I was like,
your dog doesn't.
When they're 18, they're going to be on the whole gamut of things. There's going to be like, I've got a chest of drawers, and you will have opened every drawer, and that will have drugs in. And we will. I don't care how we'll do it, but we'll make sure the quality of life is good, conventional or herbal or whatever. It doesn't matter to me. The quality of life, and then quantifying that. What is quality of life? How do you measure it? So that's quantitative measure and qualitative measures. And I think that's so important. So I think that's part of what you said of kind of prevention of sarcopenia. Pain relief sort of fits in that, because the pain relief, you're not going to potentially get as severe sarcopenia due to inactivity.
Yeah, good call. Well done. High five us. A couple of questions. I think because we've been going for an hour, please don't take offense, guys, if we don't speak specifically to you. I'm hoping that we've covered a lot of topics actually within the live. There's somebody here who, cutting to the chase, they've used steroids, they've used Librela, they've used different medications, and they're beginning to introduce hydro. How many times per week is it safe to use hydro, or any other tips to try and build muscle back in? You work very much in this sector. I'm going to let you answer that one.
So hydro, it is, I think sometimes people do think that more is better. The neurological system needs to recover. So you do really need to work up. So if you do, sometimes people come in and they pay for a half-hour hydro session, and your dog is only in there for 2-3 minutes, because by the time the water has come up, and if we talk about treadmill, for example, and it's about, in the beginning, about little and often, but that isn't literally 4 times a week. It's going to you have to give these older guys time to recover and time for that hydro regime to kind of establish its benefits. And I think people often think that hydro is easy. And I say, well, you go and stand in that treadmill, cross your arms like that, walk in a straight line at the speed I dictate, not the speed you want to walk, the speed I say you're going to walk. And you'll see after 5 minutes, you're absolutely pooped, because it's walking straight. It's actually walking with more flexion and extension, often through the joints, often with assisted movement from the hydrotherapist. It's really hard work. So there's also that thing where I can't afford every week. Well, talk to the hydrotherapist. They know your dog. They'll see the next time what they have achieved, and they'll tailor the treatment program to what you can afford.
Yeah, and also a lot of these centres have mixed skill base, and they might say, well, why don't we arrange for you to see the physio that's going to give you appropriate exercise regime, and that will work in a very nice complementary way to what we do with the hydro. I think a lot of people get really intimidated about cost and commitment, and I just think people can gain so much from just a little bit of intervention from these skill bases.
And if I have clients that come for hydrotherapy and they do no homework, we can prove.
That is so true.
They don't improve. And I say, this is not a dishwasher. You can't just put them in and it's all going to go away. You need to do your homework. And we have clients who admit they haven't got the time or the energy, or the dog doesn't want to do any of the exercises. And then, of course, our input as hydrotherapists might have to be a little bit more intense than for other patients. But I always say it's not a dishwasher. You do not necessarily, if you can't afford the hydrotherapy, then there's shortcuts. You can see the physiotherapist and say, right, I've got this amount of money and this will have to work. Give me it all, break it down in bits that I can deal with. And it's about communication. If you come in and ask me, then I'll just pace it to what I think is appropriate, but it might not be appropriate for your wallet or for your time schedule or even for your dog. So,
or your own physical capabilities. I have so many people that you're asking them to bend over and support their dog whilst doing something that I can't bend down. Okay, so that's not going to happen. But this is a good question for this person here. It's not that simple, I'm afraid. You can actually, pain is very unique to the beholder of the pain experience. And so you could have a dog that has got substantial laxity and they could actually manage it very, very well. And you can have a dog that has got very little laxity and they're not coping at all. So it's very much about observing them both dynamically and statically, palpating them, listening to your history, and making a collective decision of what does that situation leave that dog in? How do they feel about their situation? Is that fair to say?
Yeah, and I think this is where the X-ray can really throw you. You can look at the X-ray, and you must have had patients where you look at the X-ray and you think, this dog can't walk. I mean, this is the most horrendous pair of hips I've ever seen on an X-ray. Mm-hmm. And the dog walks in, and I was like, what? And he's like, I've got one. And I was like, and I touch his hips, and I do range of movement, and it's not even flinching. And I look at the X-ray, and I'm like, are we sure this is the same dog? Yeah. So I think it's don't get swayed by the diagnosis. Yes, you need the diagnosis, but just make sure that you assess the dog for what it is, not by the name tag of the diagnosis or not by the X-ray or the CT scan. Just make sure you do not say, well, he's got HD. No. What is the symptoms? What pattern have we had? Because HD, people keep wanting to show me X-rays. I couldn't care less, because actually I'm not treating the X-ray, I'm treating the dog. So that's the thing. If you say that text said about HD, well, okay.
I think that's really fair. Like as you say, you want to be interested in the diagnosis, you want to know what's underlying it, but almost you want to go in a little bit blind so you can actually see what that dog's telling you that day. And when we are given a diagnosis and a label and an X-ray to read, your bias drags you somewhere where it might not be that dog's problem that day. So treat the individual and treat the individual time. This one's a really good one because a lot of people will be interested about trigger points. And I think we're going to do 2 more and then we're going to call it a day because we're already at 1 minute 10 and 1 hour 10. This is always so interesting. And I alluded to experience being really important, being a soft tissue practitioner, because yes, muscle twitching on that side in his back leg, thumps uncontrollably, would potentially indicate tension. It could indicate discomfort. What would you say?
It could be a skin problem. Or an ear problem that they have the occipedal reflex. It would, 4 years old, definitely make sure there's nothing else going on. That's what I would say. And then a full range of movements. Again, a musculoskeletal practitioner might pick some iliopsoas stuff up. I would say first eliminate skin, first eliminate other underlying issues, and then musculoskeletal, have a look. But there might be more going on there.
Exactly. Let's put this one. This one. So yes, we talked about sex hormones being important for muscle mass, and yes, we have a huge cohort of our companion animals that are neutered, and it is something that we have to kind of fight the fight against. There are the benefits to neutering. We still mustn't forget it. I know that we are swinging towards delaying neutering now, we are very lucky to live in a country here in the UK where we have less of an uncontrolled population, but in countries where we still have a huge number of homeless dogs and cats, neutering does play a big role, so I don't want to kind of slam dunk the vet profession for being, hot on neutering. It has its place. But if you have got a neutered individual, then would it be fair to say it might be a little bit more uphill?
Definitely, we know with the males, the male dogs, that the testosterone definitely helps us maintain muscle mass. We know that hormones affect muscle mass. I read an article today where they looked at the prevalence of certain joint diseases in neutered versus non-neutered animals, and I think there's a lot of research that is going to kind of come out of that about the role of hormones. I think it would be silly to say that hormones do not affect it. I mean, we know as females, our change in hormone levels affects how we maintain muscle mass and how we metabolize things. So it has an effect. And I think, I mean, of course, once they're neutered, that's it. You have what you have. Does that make sense? Sort of. I think with the bigger dogs, I tend to sort of be in favor of neutering a little bit later. With male dogs, again, I if they're sport dogs, I tend to want to wait a bit so that they have that kind of lean body mass, muscle mass. But you have to be pragmatic as well. So if you live I live in an area where every other person in the street is walking a dog, and if they all would be unneutered, we would have
mayhem,
a real problem. And then some behavior patterns can actually be established, and even if you then neuter them, it doesn't really affect their behavior anymore. So yeah, it's a tricky one.
It is a tricky one. Is there any hope for a dog on prednisolone? Yes. Do not leave this live thinking doom and gloom. The prednisolone is there for a more dominant reason than the sarcopenia. The sarcopenia can be managed, but now you've got an awareness that prednisolone will make your life harder, and therefore you may need to work harder. So you would definitely be a contender for see a physio, chat it through, tell them what's going on in the background, tell them about your worries, your concerns, tell them what you're capable of doing every day, and they will help you out. So don't go home doom and gloomy, please.
And do not take them off prednisolone, because you could, just prednisolone is, we have a saying for it in the continent, cheap and cheerful. It makes dogs feel great. Their lives can rely on it. So do not, it definitely, that's not the message I want to give, that prednisolone is bad.
Don't anybody stop it now. Don't you start doing that.
But it's the mindfulness and Cushing disease is another one where Cushingoid dogs with have that kind of the steroid levels in their body that's off. So that's the thing. You have what you have, work with it, but don't ignore the sarcopenia and understand that it is a side effect. So if they're in the treadmill and going swimming, just understand they'll not build muscle as easily as another dog. So you'll have to put that little bit more effort in and be mindful of it.
Perfect. Somebody's asked us to spell that, and I assume that's the herb that you said commonly in the ginseng family. So I don't know.
Ashwagandha or withania, Withania, withania.
So I might get you to text that to me, and I'll put it in the notes. Do you do Zoom consultations?
See, but that's the thing. We talk a lot here about my hands. And yes, there are so because of the pandemic, a lot of us herbal vets we've been all inundated in work. There's about 40-50 of us in the country. So some of us do Zoom consultations. I've done Zoom consultations, and then I see the patient and I think, I need to change a few things. And that's the thing. I think it's really important that you from a musculoskeletal point of view, we have to have our hands on them. I do Zoom consults if there's nobody else available, and if it's a condition where I'm not too worried about not having touched them, and I have a vet that can do the touching for me. Does that make sense?
Yeah,
and it's that teamwork. You have to have a team. And I always say, your vet needs to be your best friend, because I need them to feed the information to me. And I think there will be a change now. We come out of the kind of restrictions. 10 years ago, there was maybe 10, 15 vets that were doing what I do. There's now 40, 50 and more are training, because there is more demand for it. And I like working within conventional setting with other vets, because I need them and they need me. And it's that careful dance. But for musculoskeletal, specifically musculoskeletal, I think you need the hands. These are my...
We've thought about doing telehealth for a long time to help people out, because there's a lot of followers that are in countries that don't have the services available, and it's always something I'm very sketchy about, because palpating, and it brings so much to the table, doesn't it? For the person that says, why can't I send this through Messenger? Please be aware that these are all freely available. This will remain on Facebook. All you need to do is go to our page, and you can either go to the videos and you'll find it there, or you can scroll back and you'll find it there, or you can hop over to our YouTube channel where you'll find it there. So they're always available. Sorry that you're not finding it easy to share. At this point, 10 very fast top tips. Yes. 1, 2, 3, 4, 5.
I'm ready.
5 each. But fast, because I'm tiring. So I just finished a cesarean just before we started. I was like, right, okay.
So we do 5 each then.
You are what?
We do 5 each. Is that how it works?
Yeah. So I'm going to start with 10, and that means you end with 1. 10, weight control, guys. Weight control. It's such a huge influencing factor. Number 9.
Diet. So make sure appropriate levels of protein, good digestibility, and seek professional advice if unsure, and what suits you and your dog.
Perfect. Number 8, keep them moving and expand your mind. You know, I was talking to a lady today about going and getting leaves from the garden and putting it in the box and putting some kibble in the box and get the dog up and leaning and bending and twisting and distracted, and get them up and moving regularly. Do obviously give them periods of sleep, because they are polyphasic. They need periods of sleep. But too many people just let them couch potato at home. And whilst that's happening, if they don't use it, they will lose it. Number 7.
There's no he's just getting old. It doesn't. You know, you're not just getting old. I'd like to think nobody will ever say I'm just getting senile. So just go and see your professional vet or physio. There's no just all of a sudden getting old.
Number 6, you do not need to be one side or the other. This is not a religious war. You do not need to be natural. You do not need to be Western-based pharmaceutical. You do not need to be interventional. You can throw everything from every angle at this. So please don't feel that you have to be in one sect and not explore another. Do not be scared of medications. They have their place. Number 5.
Document and record. So film your dog, and WhatsApp is a brilliant thing where you can film and send it to the practice if they have a WhatsApp number. I often watch videos before the consult, because in consult dogs clamp down and they won't move, and I don't necessarily have the time to walk them up for half an hour. So that video footage, send that beforehand to your vet so they're prepared for what they're going to see when you see them.
Like that one. Mobility aids. I always joke that I used to live in Eastbourne, and it was full of people that were going there to die, because there was mobility shops everywhere. But we need to take a lesson from this. You know, mobility aids are there to try and prevent trauma, to prevent harm, to slow degeneration, to support, to give you a comfortable life. If a certain event, maybe getting up from lying down, is painful, we as humans will use a mobility aid to help us so that we don't do further damage and we don't create pain. Think about it in your dog world. Ramps, steps, harnesses, raised bowls. It's logical. So don't deny mobility aids. Number 3.
Treat the whole animal. So if you have an underlying condition, poor gut digestive issues, poor skin, it does affect them. You cannot thrive if something else is going wrong. So don't pigeonhole them into the osteoarthritis box. They're a whole organism, and you need to treat the whole patient. So again, document if they have a skin problem. Don't sit on it for weeks and months. Just make sure that they're the best oiled machine in town.
Yeah, I like that. Number 2 for me this time is going to be join Holly's Army. We're now 11,000 owners like you who have the same worries, the same concerns, the same questions, the same need for both academic and emotional support. So please do go and join. It's a Facebook group. It's called Holly's Army, after my beloved. It's available 24/7, 365, and it's manned by an amazing group of people called the Canvassadors. Number 1.
See professionals. So there's the RAMP register, the Herbal Vets. There's a Herbal Vet Association. So if you just Google Herbal Vets UK, you'll find a whole list of practitioners. Even if there's in your area nobody there, contact one of us and we'll put you in touch with somebody who's training or who has an interest and who can help us help you. And the RAMP register would be another really important one for me. Make sure that also any person you see has the appropriate insurances and qualifications.
Amazing. And somebody's just said, does Cam have a donation page? Yes, we do. So all of these lives go out free of charge. Veerle's given up her time. I'm giving up my time. We take months to organize these lives. So for you to say you'd like to donate, that is absolutely fantastic.
Brilliant.
We'd also like to hear from every single one of you that have watched tonight. So please tell us where you were listening from. It's always nice to know who we're going out to. But please do support Cam, because we need you to support us to support you. Thank you, Veerle. I'm exhausted.
You need to go home. How many puppies did you have?
We only had 3. One, sadly, one had died at home. So then she brought the dog in, and it had a mummified fetus that was blocking the canal. So it was definitely a procedure that needed doing. But I tell you what, this is like the 3rd cesarean I've done in about 2 weeks now. So
wow.
Yeah.
Oh, bless. The nurses always get so excited because they get all the kind of, and you're still in there trying to sort of looking over the side to the puppies.
Slowly pulling out the manky placentas, going, this is so much fun. It was a good result.
And they don't come in at 9 o'clock in the morning, huh? It's always in the evening. And people forget that, when you do emergency stuff, the GDVs, the stomach torsion, they don't happen to appointments. They happen at 3 o'clock in the morning. And I think that's something I forgot to say in my 10. Be kind to your vet. Be kind to your vet. We've, as a profession, have been through a really tough 2 years. And I think you've all read the Guardian article, potentially, where vets say we're broken. And I think that's really, because you come with your little baggage of my dog's in pain, but your vet has potentially seen 50 people that day, or 10 very emotionally distressed dogs and people. And be kind, because if they can't help you that day, just write it down in an email, give them the information beforehand so that consult can be a lot more effective. And I always say, love your vet and they will love you back. So I have clients who say, we love you. And I'm like, I'm going to go the extra mile for those. And I think respect them, and they will really try their hardest. And even the new grads, they fresh out of school, they have all this energy. They want to do the best. And if they don't know, I'm 100% sure they'll ask an older colleague to sort of come with some advice. but they will do the best for you. And, you know, and that's really important. Be kind to your vets, because we have had a tough time. And I even think, you know, I do referral only, and the last 2 years, it's been really tough for us as a profession.
I totally agree. Very well said. Thank you, guys. So I'm back on Friday night. I am giving up my Friday beer drinking time. I am going to get to the pub late for you guys. It is going to be awesome. Friday night is with David Dejonckheere from over in America.
Oh, wow.
We're going to be talking about post-orthopedic surgery rehab. So it's going to be a good one. He's an amazing speaker.
Yes.
And we're really, really lucky to have him come back. So we will see you Friday at 7. They're all recorded, so you can come home after you've been to the pub, sit down with your toast and your cup of tea, and you can watch it then or the next day. All right. So till Friday, see you later.
Bye.